This really depends on an analysis of the eyes to the rest of the face and brow in relation to what you wish to achieve. More complex enhancement will require surgical correction, but if the problem is more limited to a specific concern, then a medical alternative such as filler, chemical peel, dermabrasion or skin laser might be best for you. The skin of the eyelids is the thinnest skin in the body, so any treatment, be it surgical or non-surgical, will need to be tailored and gentle. The relative components contributing to a tired or sad look around the eyes needs to be assessed by an experienced surgeon. And I think that an artistic eye is helpful to relate the appearance of the eyes and brow to the dimensions, proportions and harmony with other structures of the face. Sometimes the appearance of heaviness in the upper eyelids is more to do with sagging or droop in the brow rather than in the upper eyelids themselves, and in fact no surgery of the upper eyelids would then be necessary. Often there is a component in the brow and the upper eyelids, and then perhaps both of these need to be addressed. The tear trough is a furrow in the lower eyelid where the tissue fullness seen when younger has been lost. Now this can be from your lifestyle, it can be contributed to by your genetic makeup, sometimes it's simply the effects of the passage of time. There's usually a loss of fat, and so my preferred technique is to replace the fat. And what better place to get the fat from than from the adjacent areas in the lower eyelid, where there may be an excess or bulging of fat from the fat pads or bags under the eyes. Historically, surgeons remove the fat from the bags under the eyes, but more and more I prefer to move it from where it is unsightly and producing a bulge or a bag to where it can help soften the depression of the tear trough. Alternatively, it's possible to place fat as a graft from elsewhere, but this needs careful and deep placement, otherwise the result might not be smooth. For some patients, a filler may be the best option to treat tear troughs, and we can do that for you in our clinic. The scars from eyelid surgery usually heal remarkably well. I place them just under the lower eyelid lashes and then a centimetre or so in one of the laughter lines at the sides of the eyes. In the upper eyelids, the scar is again well hidden in the crease or fold of the upper eyelid, and again for a centimetre or so in one of the laughter lines at the outer corner of the eyes. After healing is complete, these scars should be quite difficult to detect. And of course we do undertake this procedure in men who don't cover up the scars with makeup. This should help reassure you that the scars are usually quite inconspicuous. The wrinkles at the outer corners of the eyes are improved and softened with eyelid surgery, but not always removed completely, unless a more aggressive operation is considered, which partly divides the muscle causing these wrinkles. If these wrinkles are a significant problem, then you might want to consider muscle relaxing injections using botulinum toxin. Often this is the best solution instead of surgery, or can be used in addition to surgery.